Hi, I'm Dr. Thanussha. So right now we're in the midst of a COVID-19 outbreak and quite a number of countries are on lockdown. There's been a lot of talk about how to manage COVID-19, but I want to talk about the next outbreak. Yes, the next one. So humanity is no stranger to virus outbreaks. We've had quite a few over the years. For example, just a couple of years ago, we had the Middle East Respiratory Syndrome. In 2002, we had SARS. In the 1990s, we had bird flu. And if you want to go way back to the early 1900s, we had the Spanish flu. So why do new viruses keep popping up over time? This is because viruses have the ability to adapt. Not only can they adapt, they can evolve to become stronger and more contagious. So it's safe to say that we have not seen the last outbreak of our time. So what can we do to prepare? Vaccines take quite some time to be manufactured, developed on, and distributed globally, right? Same goes for a cure. And every time there's a new virus outbreak, we need to manufacture a new vaccine and a new cure. And we can't be on lockdown forever. So what needs to change? The answer is actually simple. We need to change. Have you noticed that COVID-19 is mostly affecting densely populated cities? Madrid, New York, and even right here in Kuala Lumpur, Malaysia. So the reason? Congestion. It's as if over time we somehow just got used to living and working in small enclosed spaces. Offices became cubicles. Homes became tiny studio apartments for families. Schools and universities got overcrowded. Same goes for malls, supermarkets, and even hospitals are congested. Cities are often overdeveloped compared to the rest of the country, which leads to a higher migration of people towards cities because people are looking for better opportunities in life, right? This leads to a higher density of people in cities, which makes the spread of diseases easier. My point is that there is an unbalance and unregulated development. WHO's recommendation to the public to battle COVID-19 is to maintain a safe distance of about 1 meter, just about 3 feet, from the people around us, which is a great step. But do you remember a time that in order for a person to be that close to us, less than a meter away, it would usually have to be a close acquaintance, family member, or a friend? But right now, you just need to hop on a bus or a train and you would have a bunch of strangers pressed up against you in your personal space. Congestion. The group of people most likely to be affected by COVID-19 is unfortunately the elderly. And sadly, most of the people who have died from COVID-19 are the elderly with an associated comorbidity. That means that they had either diabetes, hypertension, or heart disease, which weaken their resistance. The stronger the immune system, the higher the chances of recovery, right? But how many of us, even young people, actually have a strong immune system? How many of us actually eat fresh fruits and vegetables or even a freshly cooked meal every day? Most of the time it's just fast food or processed food, right? How many of us have great work-life balances that gives us time to exercise regularly? Or just to grab a moment to relax? Or enjoy hobbies? When the next pandemic hits, when the next outbreak hits with a stronger, more evolved virus, will only the elderly be at risk? It is easy now to blame the spread of COVID-19 on those who ate exotic animals. But let's not forget that when bird flu was rampant, the virus spread through poultry, chickens and ducks, or JE, Japanese encephalitis, that spread through pigs. Pigs, chickens, ducks, not exotic animals. So isn't the problem more towards mass farming and our meat-eating ways maybe? I'm not vegetarian. I'm a meat eater and I like to eat meat. But isn't it time that we switched to more of a plant-based diet and started looking towards responsible farming? The most important issue that I want to raise here is that the public healthcare system needs to be revamped. My team and I have been researching on this for the last 2 years. Healthcare needs to be brought closer to communities. The focus needs to be on prevention every single person needs to have a doctor that knows that they exist, knows their medical history and their medical needs. Imagine if when the next outbreak hits, the doctor has already identified the communities that are at risk and thus is able to get testing faster to them, the elderly, the disabled, and is also able to get care and even aid to the right people quickly and efficiently. Imagine if when the next outbreak hits, there is organized and regulated development, and thus there is no specific densely populated areas like there is now, and thus the spread of disease is slower. Imagine if when the next outbreak hits, it's a virus that can spread through livestock, through sheep or chicken, but because there is responsible farming, free range, and thus the spread of the virus between animals is slower, and thus there's a slower spread of the virus between us human beings as well, or from the animals to us. Imagine if when the next virus hits, you and I are infected. But because we have a great immune system, thanks to good nutritious food and a healthy balanced lifestyle with plenty of exercise, and our immune system is stronger, and that gives us a better chance of fighting the virus. Imagine if you are elderly with, let's say, diabetes, for example, but because you have a doctor right there in your community, a doctor that knows your needs, knows your history, and has been regularly following up with you, and thus your diabetes is well managed and well controlled, and that gives you a fighting chance against the next virus that hits. Imagine if all these measures were put in place before the next outbreak. Oftentimes when we need to find a moment alone or a moment to think and reflect, sometimes people go up mountains, go into a cave, find a quiet room, or check into a spa. But right now, the world has come to a standstill due to the lockdowns and so on, and it is giving us an opportunity to sit back and reflect. The next outbreak is coming whenever, whether we are ready for it or not. But if we do not adapt, then our future is going to be endless lockdowns, living off of food deliveries and package deliveries, and talking through a screen. Thanks for watching.